It is so transdermal. I remember using this myself 2 years ago, and it felt like it was just going straight through.
Absolutely.
Patients loved it, and it's that whole lipophilic nature of the product.
Being transdermal, or just being able to penetrate through the epidermis, is really what that means. The way that this is done is, it's because the exosomes themselves are really the membranes surrounding them. They're just little membrane-bound vesicles that the stem cells release. And what they do is they pinch off a portion of their own cellular membrane, and so they're a vehicle, right? Is how I describe them, or an envelope even, you know. And we can put a letter inside of the envelope, you know. We can put whatever message we need into there, and then load it inside the envelope, and then, you know, send it off in the mail to where it needs to go. Ideally, these envelopes are carrying, you know, signaling processes for anti-inflammation, and, you know, signaling processes for stimulation of collagen, elastin, hyaluronic acid. So those lipid bilayers, or the membranes around the exosome, literally touch the membranes of our cells and get absorbed right in. So
I feel it.
There's no sitting on top in the epidermis. There's no, you know, crusty layer. Even some of our products that, you know, almost like a fatty content to them, they still sit right on top and feels greasy.
Correct.
You don't have that with EXOE because it's penetrating fully transdermal, and it goes through the entire dermal architecture. Once you get through the epidermis into the dermal layers, the cells pick it up and then they pass it to one another through, you know, transcellular communication, and then it's absorbed through the entire dermal architecture. Additionally, pre-treating does another thing, which I'm sure you've noticed, is it will dilate the pores as well, because it's designed to do that, but the vehicles will actually help your numbing cream absorb deeper as well.
It does that.
Yeah, so you get a better numbing effect down into the deeper dermis, so then your treatment is a much more pleasant experience.
So much more comfortable. I mean, we were getting pain, redness, swelling, etc., which we do expect with RF needling and fractionated laser treatments. But having used that now for coming up to 2 years, we just don't get that anymore. The redness is maybe 12 hours long, but I would say 100% less than what we used to get before. So that makes total sense, the transdermal delivery. The other thing that it also does, out of feedback from my patients, is they don't get itchy as they're going through the healing phase.
The itchiness comes from what histamine release, right?
That's
so
right.
if we reduce, and acute inflammation really causes, you know, mast cells to release a bunch of histamine. Well, if we mitigate those factors, right, the pro-inflammatory factors that release, again, the redness, the itchiness, you're gonna decrease that response. And then continued inflammation in the body will actually continue that histamine release. So that can last for a couple days sometimes, the itchiness. Well, you don't have that problem when you utilize EXOE because you've mitigated that response. You've reduced it by a factor of 61%, actually. We've proven that clinically, you know, in labs, in vitro, you know, with studying it on human cells. And so, remarkably, that helps the healing process, one, to just be more tolerable, and two, to go so much faster.